Great. Okay, welcome everybody, and thank you for joining us for our webinar this afternoon. We're really lucky today to have Dr. Peter Wayne, who is a world expert on Tai Chi and the director of the Osher Center for Integrative Medicine at Harvard Medical School and Brigham and Women's Hospital. And Dr. Wayne is going to talk to us today about Tai Chi and healthy aging. And he'll talk for about 45 minutes, and we're going to have time at the end, as we always do, for Q&A. So if you have any questions at all during the talk, go ahead and enter them in either to the Q&A or to the chat if you want them to be public. You can direct it to me if it's a more private question. And then at the end, I'll collect the questions and we'll have some time for a discussion. So without further ado, thank you, Dr. Wayne, for being with us today.
Well, thank you, Dr. Lewis, and thank you to Ms. Solom for organizing this event. It's a real pleasure and honor to participate in anything associated with the Lown group. It has such a great reputation, and all of our patients that we share just speak so highly of your program. So I'm going to talk to you a little bit about Tai Chi and healthy aging, and what I want to just disclose, of course, is that in addition to being a researcher and an academic in this area, I also have a community-based school, and like good researchers, I keep a good firewall between my community-based activities and my academic ones. So I want to start broadly, and I think everyone on this call will appreciate where Western medicine has gone in the last pretty much just 120 years towards specialization. And we're all really grateful that if we have an eye problem, we can go see an expert, an ophthalmologist, or if we have to get a knee surgery or a hip replacement, we go see a surgeon, an orthopedic. And of course, in this group, if we have any cardiovascular issues, we want to go see a cardiologist. And we're really appreciative of that specialization. These specialists spend a great deal of the time focusing on all the new knowledge in this area so that they can give you the best advice and care. But I think all of us would also appreciate that there may be some cost to this specialization. And that cost might be in looking at the body in terms of separate parts, and also the fragmentation in which we get our health care in systems unlike the Lown Center, which often are not integrated with other programs and not as holistic. So sometimes, one physician will take a look at one part of your body and really focus on the details there, and another one to look at the other part. And sometimes we miss the forest for the trees. There's a fragmentation in this specialization in organ-based medicine. And so this is where integrative medicine comes in. And integrative medicine is about treating the whole person. And it's not just about putting a Tai Chi teacher in a cardiovascular center or an acupuncturist in a pain clinic. It's about treating the whole person and enhancing the interconnections between the systems, between the mind and the body, and even personal interests as spiritual views of life. And this is nicely characterized in this diagram here from a book on Chinese medicine, where on the right, there's a much more ecological or integrative view. And the goal of your team of healers is to make all the systems work together. It's almost like tending to the garden. And there's a focus on the interdependence between all the systems, how the heart and the kidneys and the brain and the emotions and the body all integrate in an ecological way. And in contrast, and this is obviously an extreme polemic, in some forms of Western medicine, the body is really thought of as a series of parts or machines that these pieces are replaceable, and there's not as much integration. Okay. And so what I'd like to do today is focus a little bit on this more Eastern integrative view of health, integrative medicine, and use Tai Chi as an example. And in order for us to have a maybe more meaningful experience and also to have a taste of it and to understand and appreciate the research that we do, I wanted to start off with just a little bit of a 10-minute experiential session. Then I want to come back to Tai Chi as an ecological intervention, a multi-component one. It's almost like a multi-drug intervention where the breathing, the movement, the attention that we give to our body as we're moving is like a multi-drug intervention that goes into the whole ecosystem and shifts it in an integrative way. Then I want to pan out a little bit and tell you about the research that's going on, and many of you will be quite surprised at how much work has been done studying Tai Chi for many things. And I'll be focusing on 3 areas today where there's good evidence in terms of balance and fall prevention, in terms of cognitive health and slowing down potential declines in that towards dementia. And of course, I'll spend some time talking about what we've learned in our studies and others around heart health. And then, as Dr. Lewis mentioned, we'll have plenty of time at the end for some questions. So we're going to do a little bit of an experiential session. And I'm going to do this in my office here. So it's a tiny little space in my home office. And I invite you to join me. None of this is meant to be forced or exerted. So be respectful for any limitations you have. It's going to be very gentle and easy to follow along. But if at any time during this you want to modify anything we're doing or just sit and observe, please respect that. And don't do anything that doesn't feel comfortable. So I'm going to unshare my screen so that you might be able to focus a little bit more on my movement patterns. Okay. So see if you can find a place that allows you to move your arms a little bit. And again, these movements are going to be quite simple. And before we start, I just want to invite you to just come to a comfortable place in standing. And before we start moving, just notice how your feet meet the ground, the sensations in the soles of your feet. You might notice how you're standing, whether your head feels easy sitting on your shoulders or a little bit more of like the deer in the headlight model, a little tight and held. Doesn't matter, just notice. And feel how you're breathing. Don't force any particular patterns, but just notice where the breath goes when you take a breath in. And notice the qualities of the body as you let go of your breath and invite relaxation. And I want you to start to let your weight shift or pour from side to side. You have a base of support about as wide as your hips or shoulders. And you're just gently rocking your weight from side to side. And one of the things you'll appreciate immediately from these mind-body movement exercises is that the second we start moving with a sort of meditative intention or mindful intention, movement helps us feel. So feel the bottoms of your feet as you move. You might notice more parts than when you were standing still. And be curious, which parts of your feet can you feel and which ones are still a little less obvious, a little less awake. I use the word pouring, and it's a nice, not only metaphor of Tai Chi, pour like water or flow like a river, but as you all know, it's also literal. You're about 70% liquid. So as you pour your, what we call the inner ocean from side to side, just notice how juicy the arches, the heels, the toes, the places between your toe bones are. And is there a way of gently rocking and letting this juice rehydrate, lubricate, nourish, kind of wash through all these areas? And we love our feet. They take us everywhere. They help us exercise. They're really important. Of course, we don't just care about feet in Tai Chi. So we want to start to feel these subtle waves around our ankles, our calves, our shins, our knees, as if we're just gently massaging and washing this juice through. And try not to think too much about it. I'll talk a lot and give you images or things to explore, but your goal is just to feel it and give your brain a little rest. Notice how the waves start to wash up through your legs as you start to feel it that way, through your groin, your hips. The British sometimes say we have a lot of knots in our knickers. So just see if you can let your tailbone, your pelvic joints, just kind of unravel those knots and let these sensations, what we call ground reaction forces, these waves in your legs, just wash through your groin, hips, into your belly and lower back. And while you're doing this, just breathing comfortably, no forced rhythm. And then maybe you feel this movement through your back muscles and your chest and all the organs, your kidneys, your liver, your spleen, your heart, start to float like little buoys in your ocean. You unsqueeze to let these waves move through your shoulders, Even lobes of your brain just feel bathed as you rock back and forth. And it has its own special ocean, the cranial ocean. Your face relaxes, your neck, your jaw. And then we add a little bit of a turn. So when you get to your right leg and you feel safe there, see if you can raise your left heel and just let the knee fall towards the opposite side. Okay, so you commit to one side with a slightly bent leg. Then you shift to your left side, set the knee up safely if you can, and let the right knee fall. So you're committing to one side. You're working on your strength, your balance. But one of the things I want you to notice as you swing is when you get to one side and you let the other leg let go, how willing is it to let go? Okay. So if you're type A and driven like I am, we're always doing something in academia, you go, okay, next time I shift to one side, I'm really going to relax my opposite knee, let it hang, really let the whole leg rest deeply. So now we're doing what's called Tai Chi swinging. And you can see we're starting to add a little bit of cardiovascular. And even though we're moving a little faster, we're still not going anywhere. We're just moving to feel the feet being massaged, to let the waves pass through the legs and belly and back, and integrating all the parts up through the neck and shoulders, all the way out to your fingers. Your head has two choices. It could be like a deer in the headlight, and that startle reflex held, or like a little bobblehead, just continuously adapting. So we want that latter, just easy jaw, easy neck. And how we hold our neck really impacts our whole nervous system. Okay. And then we add a little bit of self-massage or stimulation. So the arms swinging, one of them now crosses over and taps the corners of your chest. Just little taps. This is called drumming the body or drumming the chi. And you know when you play a drum, you make sounds. And sounds are simply just vibrations. So you're just vibrating your body just to bring a little sensation, blood flow, wake up the nerves. Start to feel all the parts that may have become less connected. Okay? And then we tap just beneath the breast on the ribs. Still shifting completely to one side so the other side can rest. And you get your strength and balance training. A little bit lower down the sides of your belly. Just letting the little vibrations be felt deeper and deeper into your body. Back to the middle, the breastbone. I'm going down the button line now. And the solar plexus, middle of the front of the torso. And then your navel. A little lower than the navel. And finally your navel and your lower back, the kidney area. So it's just like a little self-percussive massage. And then the tailbone and your lower abdomen. And then just letting that rest. And you might feel a little bit of vibration in your body, a little tingling, a little sensation. And you're very curious where you feel a lot of it, but without analysis and judgment, where you feel less. And you just try to soften those areas so the ocean redistributes into those little nooks and crannies that have been squeezed or shaped in a way that doesn't let the juices in. We do one or two more exercises that are a bit more dynamic. So the hands come up, and you stretch your fingers out a little bit, open up the webbing between your knuckles, and then as you release, you just slightly bend your ankles and knees, very slight. The body stays upright. Okay. This is a way of connecting the feet and the hands, the lower and upper body. And as you do this, and only going up to where it's comfortable for your shoulders, so be careful if you have any shoulder injuries, you just start stretching. And the metaphor here is like you're wearing a onesie or feet pajamas, but with gloves. And so as you stretch your fingers up gently, that stretch is not only felt in your hands and your arms, but down your flanks to your toes and the bottoms of your feet. So you're stretching the fabric of your body. the fascia, all the connective tissues, muscles, and joints. And you might take a couple cycles to focus on the planes of tissues from your heels through the backs of your legs, lower back, neck, fingers. And you can go slower than I'm going, or faster, bigger, smaller, but it's gentle, never forcing or straining. And also feel the front, the tops of your feet, the shins, chest, the face, the fingers. This little doing, a little yang in Tai Chi, they call it, and a little letting go, a little yin. So the body's always making these yin-yang patterns. Good, and then just let that rest. Okay. The hips are really important. They connect the bottom and top. You have a lot of back problems and abdominal issues. So we stay comfortable in our feet, soft ankles and knees, and just make little circles with your hips over the floor. The head stays fairly stationary over your feet. And again, the goal here isn't to clock a lot of reps or go as fast or big as you can, but you're using movement at first to just feel. So as you're going around, as if you had a clock face on the floor, how many 5-minute points do you touch with your hips? Do you pass through easily? And don't push it if you don't. Just noticing. How many 1-minute points? And while you're tuning in, what's the quality of your attention? Maybe you can remember that you have this warm tropical ocean that can start to seep into all those tissues and begin to soften them and rehydrate them and melt some of the glue that builds up over time. But never pushing. You don't want to create more fear. As you move your hips, don't forget that they're connected. So you should feel this in the bottoms of your feet pajamas, the integration of Tai Chi, as well as through your neck, your chest. And really good advice, don't stop breathing. Just notice it. And then the other way. Not the same thing backwards, just a whole bunch of new places to notice. So it's meditation in motion. Just moving not to get anywhere, but just to almost draw your attention and intention in. Good. And then you come back to the center. We'll do 2 more movements. It's called the fountain. And you just cross your wrists on your midline and you stretch out gently your ankles, your knees as they straighten, your spine, right up through the top of your neck, and then out to all your fingers, just like you're stretching out all of the joints, just maybe 60, 70%, never to the max. And then there's a deep letting go, the yin, the relaxing. So gentle stretch, ankles, knees, and connecting all the parts as you bring your attention through them, right through your neck, through your spine, through your elbows, wrists, fingers, gently opening and gently relaxing. And one last time, all the way, like a starfish opening, breathing comfortably. Good. And then we finish with the hands going the other way with a very different intention. Here we use a lot of imagination, imagery, or placebo. So the hands just float out. But we picture ourselves in a beautiful place in nature, maybe a beach or a mountaintop or a quiet garden, and it just feels so nice to be there that we take the energy, or we imagine we could bring this energy from nature, and we bathe ourselves with it, not just our face and head and the outside, but it goes into every blood cell, bone cell, muscle, nerve, organ. Just breathing it in and trusting it to wash through every cell using your imagination. And any tiredness or tension, including your legs, you just wash it into the earth. Trust your local recycling program, just let it go. And 2 more times. Maybe there's a little sunshine or blue sky energy or beautiful forest energy, and it just makes your brain cells feel a little better to be bathed, and your face cells, and your neck and shoulders. You can breathe it in. all the way through your body, but it's really important that you go through your legs, through your belly, through your legs, all the way down to the earth like you have trees, tree roots grounding you. And last one. And set it up, but try not to think it too much, just feel it. It's called washing yourself with chi from nature, all the way through your body and down into the ground. Good. All right, so take your time, be careful in the transition, and let's see if we can get the screen going again. Good. Well, welcome back. I wish I could see you all and that this was in person, but I'm just going to trust that everyone's doing okay, and we'll have some time to check in about your experiences. But I want to shift now. And so what just happened? And one of the things that I think becomes obvious now that we've had this shared experience is that, well, this is just a little taste of Tai Chi, but it's this multimodal intervention, a lot of moving parts there, a lot of components. So we had a little bit of aerobic exercise, and you can modulate that. We're certainly standing, and we're creating some flexibility. So it shares many of the features of conventional exercise. One of the things that we emphasize is not just the pieces, but how they all fit together. What we call dynamic structural integration. So the feet, connect to the waist, the connect to the hands, and the front and the back. And so this biomechanics is a really unique aspect of Tai Chi training. We're constantly being aware of any tension, not just in our physical body, but in our thought forms and relaxing. And a lot of our work is around the relationship between cognitive and motor patterns. We're asking people to pay attention, to be mindful. In some ways, you can think of, those of you who've done some mindfulness meditations, this is mindfulness on wheels. But it's not just noticing parts. Once we're in there, there's a quality to it. There's some imagery, there's some intention, there's some visualization. And we know from really good research, all of these elements are therapeutic. But here, for example, what we believe deeply affects how we feel. We know this from good imagery work, but especially from placebo work. And breathing, obviously really important. And there are many aspects of breathing we didn't touch on, but it's an integral part of this. And often this is taught in a group, but even virtually, having someone else's voice to respond to, or someone else's body movements, or being part of a community. We know being isolated is almost as bad as smoking in terms of health impacts. So these communities can have therapeutic effects. And even just the philosophy, flow like water, maybe doing 70% effort is better than 100% effort. But it's not a philosophy in your head. It's an embodied philosophy, something that you can apply to your body in real time. So you get all these therapeutic ingredients, what we call the 8 active ingredients of Tai Chi, what I've called the 8 active ingredients of Tai Chi. And that, I think, distinguishes it from more unimodal, for example, aspirin. Aspirin's got this one compound that targets a set of receptors in the body and has a physiological effect, which is great. This has many therapeutic components that targets many different systems in the body and adjusts it ecologically. Okay, so that's the main take home, that these are very different interventions. Okay, but it's probably good to just give you a simple definition. This is what we use in our work, that it's an exercise that's rooted in a number of Asian traditions, including the martial arts and medicine and philosophy. And as you've experienced, it integrates slow, mindful movements with breathing and a number of cognitive skills. And the aims of Tai Chi are varied depending on who's practicing it for what reasons, but it's to integrate the physical body and the mind, and through that improve health, self-awareness and development, and at some levels, Tai Chi is a very high-level martial art as well. Okay. So what's the scientific evidence here? And so I wear 2 hats. One is 3 hats. One is as a Tai Chi researcher, or actually integrative medicine researcher, and we've got many trials that we've done in different areas. and I run the Mind Body Movement Laboratory at the Osher Center. My academic hat there, recently I just became the director, so interested in how our research program integrates with educational programs as well as our clinic at the Osher Center. And then for a hobby, I teach Tai Chi in the community. So on a good day, I have the best jobs. I get to go back and forth between my different activities and apply what I learned from my students and teaching to inform the questions we ask in the laboratory, and what I learn in the laboratory. I'm working with all of my brilliant colleagues across the Harvard Medical School campus. That informs how we design Tai Chi programs and we teach them. So many of you be surprised at how much research has been done just in Tai Chi. This is a little dated, I apologize, but in 2018, just in the English language, and there's probably at least as much, if not twice as much in Asian languages, over 1,100 peer-reviewed scientific articles in medical journals. Importantly, about 30% of those are what we call randomized controlled trials. And over time, the proportion of randomized controlled trials have gone up. And these are better because they're less biased, they have controls, just because there's a lot of research doesn't mean it's true or good research. So we've tried to vet this, but all in all, it's quite remarkable how much has been devoted to this. Okay, these are the areas from a sort of 5,000-foot view that people have devoted most attention to. Balance in older adults and fall prevention, I'll be talking about that. Cardiovascular events, conditions and risk factors, I'll say some things about that. And I'll also be talking about cognitive function. But there's good research on managing cancer symptoms, excellent research on neurological conditions in terms of Parkinson's disease and stroke, and other respiratory conditions like COPD and asthma. Okay, so these ones with little asterisks next to means that not only are there good individual trials, but there's what are called meta-analyses or systematic reviews that have pooled all the data, and based on those syntheses of information have concluded that there's a potential benefit. Okay, again, these are the areas I'll say some things about. I also just want to say something about safety, because really important part of any base of evidence is it's safe. And the short answer from a teaching perspective and also from research is, yeah, for the most part, it's quite safe if you don't have any serious conditions to begin with, and you do it with reputable teachers in a safe environment. We did a review of about 152 studies, including some of the studies we've done with people waiting for heart transplants or serious balance issues or pain. And by and large, there were no serious adverse effects. Like any exercise, there were some muscle aches and pains because there's no free lunch out there. But by and large, it's safe. We need more data. A lot of the data to evaluate safety is quite poor, but I think overall, and especially compared to some more vigorous exercises, the safety profile for Tai Chi is very good, even for people who have serious conditions and are deconditioned from not doing exercise. Okay, so I'm going to speak about balance and fall prevention to begin with. And I think most of you appreciate the relevance of this area, this topic. Many of you know that about 1/3 of adults over the age of 65 fall each year. And 1/5 of those that fall and have a fracture die due to that event, not because of the trauma itself, but because of the whole sequelae. There are changes in lifestyle, their inability to exercise and socialize, and other complications. So it's quite serious. And then of course, those with traumas really impacts their life, their families' lives, and their quality of life. The cost associated with falls in older adults is now estimated to be about $55 billion per year. This is really serious, and because our population is aging, these numbers are expected to expand. So it's a very important public health issue. And concerns about falls, and I'll say some more about this in a few minutes, really can change your life. Changes how comfortable you are socializing, doing various activities, and of course that'll impact your cardiovascular health. Okay, and there's no pill to take for preventing falls. It's just a complex system. Okay, so the data on Tai Chi for falls is some of the best data that we have about Tai Chi, and it's also one of the best interventions we know when you compare all potential conventional and alternative interventions for falls, the most recent estimates are about 20 to 45 or 49% reduction just following 6 months or so of training in Tai Chi reduces the risks of falls. And this newer work has shown that this applies to people with Parkinson's, to stroke, to people who begin with a high risk of falling. The data is quite strong, and I'm a conservative scientist, so I'll be very conservative in my conclusions here. But this one I feel fairly confident in. Why? And I just want to go back to this ecological model. So we saw all these active ingredients here in this cartoon. And these are the things that we've seen in physiological studies that are risk factors for falls that may explain why it's so effective. It's not just affecting any one of them, but in most people, it's affecting most of them. So it strengthens legs. Weak legs make you more likely to fall. It changes the proprioception, the sensitivity, especially in the soles of the feet. If you have weakening sensation as the nerves lose their sensitivity, or you have diabetic neuropathy or chemotherapy-related neuropathy, and you start to rock forward or back, your sensors in the pads of your feet don't pick those signals up and don't tell the muscles to fire in a certain way. So by enhancing that sensitivity, we have better feedback and quicker responses. And we've seen that in studies where we put people on a treadmill, and obviously they're wearing a harness, and as they're walking, the treadmill might slip sideways or jolt or stop and start, and people who've done Tai Chi react quicker and with smarter sequences of muscle firing. I'm going to say more about cognition, but falls have not just to do with your physical body, but how you pay attention to your body, and also the emotions, the fear of falling. But I'll come back to that. Pain is another really big contributor to falls. Being in pain can be distracting, it can change how you walk, and there's a good profile of Tai Chi for osteoarthritis and for back pain. I won't be talking about that now. But the main thing I want you to see here again is what integrative medicine is. Integrative medicine isn't so much just a therapy, it's a concept. It's saying that these multimodal interventions change the ecology of the individuals that practice it by touching many systems and making them work together as a whole. Okay, so one clear way that mind and body come together is through fear of falling. And if there are people in this audience who've had a fall, you know about it, or if you've watched someone who's had a fall, there's a very guarded phenotype, a way of moving there. You hold your upper body, you're a little distracted, you're a little fearful, there's holding of the breath, and that makes it, ironically, more likely to not do exercises. So you limit your activities. That reduces your mobility. You lose more and more confidence, and it makes you much more likely to fall. So one of the biggest predictors of falling is being afraid of falling. It's like a vicious cycle. It's a terrible thing, and it's hard to break, and you can't just talk yourself out of it. But Tai Chi helps you communicate with your body to change that. Okay, so there's really good evidence for this. And I just want to go back to where we started. We started with pouring your weight, right? And most people who have a guarded stance, whether they're protecting against pain in their knee or hip, or they're afraid of falling, are unaware of it. But if you just stand still, maybe even holding the back of a chair and start rocking back and forth, you can notice the guarding and the holding in your feet, and you can slowly convince them maybe they can soften and let the juice in and connect to your calf, shins, knees. And you might notice that you haven't breathed in the last 40 seconds, and you go, oh yeah, and your center of gravity drops. So this is how fear of falling changes in an embodied way. It's not just a concept, it's a physical sensation. And there's good data suggesting from many studies that Tai Chi reduces fear of falling by about 35 or so percent, and that this change, this behavioral change, contributes to the effectiveness of Tai Chi of preventing people from falling. I'd also just say that more generally, it's not just falling, but people who are afraid of exercises, they start doing this, they feel a little bit more confident, what we call they have higher self-efficacy for exercise. And we started to call this a sort of gateway exercise, a path through which people can come back into exercise with a little bit more confidence and body awareness so they don't hurt themselves. Okay. So I just want to say a couple things about cognition, and like with falls, because of our aging population, this is such a big issue. The number of people in the United States with early states of cognitive decline, what we call mild cognitive impairment, are estimated right now to be about 5.5 for the people over 70, 5.5 million people over 70. And there are another 3.5 or so with full-blown forms of dementia like Alzheimer's disease. And these are horrible conditions, and there are no good pills for this or no other good pharmacological agents. And we get a lot of good promising trials, and then most of them have not really panned out. And the cost is staggering. It's $150 billion a year. Back in 2010, these numbers are rising exponentially. So we need something for this. And again, Tai Chi shows some promise, not as strong as in balance, but there's some promise here. We've done some syntheses of literature. There was about 11 studies when we first looked at this almost 6 years ago now. And there were some good improvements in overall global cognitive function, but especially in the domain called executive cognitive function, which is sort of like the executive of a company. You know, they delegate. You over there do this, you do this, let's coordinate. And it allows you to multitask, to shift attention. And those are really important when you're out in the world having a conversation with somebody and being careful to not trip over the curb that you're walking past. So that loads into the balance as well. Okay. This just gives you an idea of one of the studies. This is a little dated, but it's a nice study. This was done in Hong Kong, and it's a modest-sized study of 120 people, and it had 4 groups. They were all fairly cognitively intact. This is the mini mental exam, and 25 and over means that there's no dementia whatsoever. So these are relatively healthy people. 4 groups of people that were allocated to Tai Chi or aerobic walking or some form of social interaction, which we know could be good for your brain, or a control group. And this was done 3 times a week. So it's a good dose for 40 weeks. So there aren't that many studies like this. Okay. And this is what they found. They found, and this is executive function, the lower your score, the faster you complete your task. So Tai Chi had a really good effect on executive function. None of the other interventions seemed to affect that. There was an overall dementia index, and the higher score is better. Tai Chi did well. There was some positive benefits to social interaction, and those outperformed the other 2 groups. And then they actually looked at total brain volume using an MRI scan. And they actually, in just 40 weeks, detected some small changes both in the Tai Chi and this group. So in this study, Tai Chi was beneficial, maybe more so than some of the other interventions. But I want to say that walking is one of the best things you can do. So don't stop walking, walk a lot, walk fast, walk slow. And as you learn Tai Chi, walk mindfully. But there's good data on Tai Chi, walking for just about every outcome, from cardiovascular to cognition to just general well-being. Okay. There's some good research coming out. There's a lot of research on mindfulness meditation and the brain, not as much on movement, but there are a couple nice studies out that suggest that not only do we see clinical effects, but that the brain changes in some of the markers for brain health, such as brain-derived neurotropic factors that increase synaptic connectivity, change in a positive direction following Tai Chi. Okay. I want to just share a little bit of my own work about the mind-body connection, and it'll become obvious how Tai Chi can help here. But this is a woman who came into our lab. These are actually her footsteps on one of our devices. And on the top, she's walking just normally. She's about 70 years old. On the bottom, she's being asked to count backwards by 7s. And not only can you see that she's walked to one end of the mat and the other faster on the top, but look at the regularity in her steps. There's equal spacing, lengthwise, widthwise on the top relative to the bottom. It's a bit more regular and slower. So when we do a complex task of moving and thinking, there's a trade-off. There's a cost to thinking. And what we want to know is if this woman learns Tai Chi and she's given this task, will her walking look more like the unimpeded task or the unchallenged task? In other words, can she integrate the mind body literally, and as it manifests in the health of her gait? And the short answer is yes. We've done a number of studies. This is a study, one of our postdocs who's now up for associate professorship, Brad Manor, here at Harvard. These are people in one of our Hebrew Senior Life's assisted living facilities. These are not spring chickens. The average age was 85 years old. A number of them turned 100 during our study. So it's not too late ever to start Tai Chi. And what we saw was that compared to an educational control group, those walking while they were given a task, and in this case, walking speed is better, did better following 12 weeks of Tai Chi than the control group. Okay. We've also looked at that regularity. It's called stride time variability. And the more regular the walking, the better. And you could think of the extreme challenges to regularity in Parkinson's, where there's freezing of gait, and then that freezing is broken. And so healthy walking has more regularity. So in this case, people who are Tai Chi experts have much less variability than those who haven't studied Tai Chi. So we've looked at that. And this is important because this variability is a much more sensitive predictor of falling than walking speed, although both of them are correlated. We've also done this in Parkinson's disease, and this stride time variability while people are counting, this cognitive motor task, is improved by 6 months of Tai Chi and Tai Chi, but you don't see that in the usual care group. Okay. So just want to shift now just for a couple of little insights into cardiovascular health. And one of my colleagues, Dr. Gloria Ye, has a strong portfolio of work in heart failure and COPD. So some of these slides and some of this work comes from her group, and we've been collaborating since 2000 on studies for heart health. Okay, and I think based on what we've learned so far and what you know, very important parts of cardiorespiratory health that all interact are moving, physical exercise, breathing, how you breathe, the quality of your gas exchange and the emotion that goes with it, and your body awareness. And all of these affect fitness. They affect risk factors such as blood pressure and lipids, and they affect your cognitive well-being, which we know feeds back on your cardiovascular health. Okay, so I just want to show you a couple examples of the research in this area. This is a study that was done in Hong Kong not long ago, and it had about 250 people. And it's interesting because they compared brisk walking to Tai Chi for people with hypertension as well as other risk factors. And what they found was that that Tai Chi improved systolic blood pressure, some markers of blood sugar, hemoglobin A1C, stress, and self-efficacy. And interestingly, Tai Chi was better than the brisk walking in this study, even though the brisk walking made the heart pump a little bit harder and faster. Okay. This is more of a meta-analysis of studies of people with risk factors that have essential hypertension. It's a group of studies, I think, in this case, 15 studies that pooled almost 1,500 participants. And Tai Chi, when you pool all that together, again, improves blood pressure, cholesterol, including LDL, blood glucose, and overall quality of life. So there's some evidence that this relatively slow-moving mindful exercise can impact very important risk factors for long-term cardiovascular health. This is a study that we did with heart failure patients. In this first study, it's a very small study we did at Harvard, one of our earliest ones. These are stage 3 and stage 4 heart failure. Some of them were waiting for a heart transplant. So these are quite ill people that were very deconditioned. We took them through 12 weeks of Tai Chi. These are some of our participants. They met twice a week for 12 weeks. We teach them very simple Tai Chi, so it's not hard to remember. This is dated, so we actually gave them videotapes so you can get the idea. And they really liked it and participated at home. We saw some nice improvements compared to the control They walked, so this is a measure of exercise capacity, 6 minutes, how far you walk in 6 minutes. We also saw their overall quality of life went up while the control group went down over that period of time. And surprisingly, we saw some changes in stress markers of the heart, natriuretic peptides. And some of these have been replicated in other studies. We did a longer study, bigger studies is small, and we compared them to an active control group that met the same amount of time with a cardiac nurse. So they got together twice a week, talked about various aspects of self-care. And this is what we saw in the same quality of life score. In the Tai Chi, the higher your score here, the more symptoms you have. So the quality of life improved much more in the Tai Chi group, and it was stable for 6 months. We also saw improvements in mood, and in particular depression, exercise, self-efficacy, and physical activity. So people started exercising more. Okay. This just highlights that stress is important. We all know this. Life is stressful, so it's not a bad thing, but we want to manage it. And it just shows you that here, this is the relative risk for a cardiac event. This is smoking, and this is stress. So stress and how we feel is really important. And I know that people at the Lown Center really pay a lot of attention to holistic views of health and encourage not just good eating behavior and exercise, but mental health as well, okay? So this is what we just said, it's not any less important than having diabetes or smoking or high blood pressure, okay? And there's a good body of research, not as great as falls, but especially in cardiovascular populations, that it's beneficial to managing your mood, quality of life. This is a meta-analysis by a colleague of ours, Ruth Taylor-Pillier, and she looked at 15 studies. These are different studies than the other one, close to 2,000 patients, and they saw really nice improvements in quality of life, depression, and psychosocial distress, specifically in patients with cardiovascular disease. These are a couple quotes just to bring in the personal perspective. So women in one of our cardiorespiratory studies, Tai Chi made me feel more in control of my body. It made me feel healthier, more vigorous, able to do some of the things that I probably could do, but I was just a little afraid to do with the heart. This made me feel like I can probably do more. Again, this idea of a gateway exercise. And maybe like another one of these physical promoting. So I want to emphasize it's not an either or. I wouldn't give up all your other exercises for Tai Chi, but this is a nice thing to complement it with. I do more now. I'm riding the bike on a daily basis. I start off doing my Tai Chi, loosening my body and breathing. Then I get on my bike. That's what they taught me. I get on the bike and start riding and meditating. And it's nice when your patients actually do what you tell them to do. So, so just to pull us all together, I think it's fair to say that Tai Chi is a promising intervention for many domains of healthy aging. We focused on balance, cognition, and cardiorespiratory health here. The multi-component nature, the mind-body nature of this intervention may give it some unique advantages over just doing strength training or just doing aerobics. It's a multi-component intervention. And as I said, I think it's viewed as a complementary and integrative part of that complementary and integrative health strategy, including conventional care, exercise, and other health styles. Okay. So those of you interested in learning more about the Osher Center, you can go to oshercenter.org. We have webinars similar to this every month, grand rounds that are open to the public. We have conferences that are free that people can learn about integrative health, and there are all sorts of resources there. And you can learn more about our research and our team. And the work I did was done by a big group of people, funded by NIH, and grateful for you guys listening.
Oh, thank you so much, Peter. That's amazing. Maybe put off the screen share.
Oh, good, good, thank you.
Then we can take some questions from the audience. So I wonder if you could address a little bit about the current pandemic and COVID and the unusual stress that everybody is under. Even many of my patients tell me I'm doing great under the circumstances, but the circumstances are really difficult politically, COVID, and I think there's nobody who's not affected by that. A lot of this data comes from pre-COVID where people were together in person and the research is in person, but yeah. Think about Tai Chi now.
Yeah, it's a great question. And so I'll give you two responses to that. One is my community school's been virtual for, since COVID. And I thought it was going to be really impersonal and very hard to reach people. And I think the way we all teach, we teach verbally, but we teach about getting to know yourself. And I think as clinicians, you may have the same experience. I know my physician colleagues and psychology colleagues, sometimes their connections are even better because people feel connected, but they feel a little bit safer in their own space. And in a class, sometimes people feel a little self-conscious and they're moving and everyone's watching. I've been so surprised at how adapted the programs have been, how in some ways I think even more therapeutic and deeper. And I think it's working. And then from the research perspective, we have some studies. We're doing a study, for example, for caregivers of cancer patients. And we teach this virtually because the ability for them to get out into the community. So there's good evidence as well that some of these things can be delivered virtually. I think we have to change how we do it, but by and large, it's making a difference. And it really is I know for the people I work with, just such a wonderful gift to help manage these really challenging times.
That's wonderful. I hope everyone was doing the exercises with you. I was doing it, and then I went out to talk to Sydney, and she was doing it, and it just feels really good to be in.
And it's simple. Yeah.
It is. So someone asked about the difference between Tai Chi and yoga, especially regarding balance and fall prevention.
Yeah, that's a great question. So if you took that wheel of active ingredients, many of those elements are common across all styles of Tai Chi, across yoga, across therapeutic movement. So there are more commonalities than differences. Some yoga is quite dynamic, like flow yoga. Some is more static. Some Tai Chi, Qigong meditations are quite static. Some are my movement. But what I would overall say is that Tai Chi evolved out of the martial arts. You're fighting, and it's a very practical thing. So those skills translate into lifting things, opening doors, getting out of the way of moving objects, managing complex surfaces. Whereas I think yoga is less concerned about dynamic activities in daily living. So the profile for falls and Tai Chi research is much better than for yoga. I think yoga helps some, but the research is not as robust. And I think the way that it's more taught, it has lots of benefits, but in terms of balance itself, may not be as robust. As one of my teachers would say, you learn a lot of good things meditating on a cushion, but if you do Tai Chi, they can't knock you off the cushion.
Okay, and for a lot of our patients, there are limitations, physical limitations. So scoliosis, Parkinson's, birth injuries. If you were confined to a chair or a wheelchair and did Tai Chi, would there still be some element of benefit?
Yeah, and there's actually a number of adaptive programs for chair Tai Chi, just like this chair yoga. But speaking, and the evidence for that is, not as robust. There's not as many studies, but people have reported good benefits, and there's some positive studies. But more generally, Tai Chi should be thought of the way we teach it, like a really comfortable silk garment you drape over your body. It adapts to where you are. So you're not trying to fit yourself into somebody else's, spandex suit or anything like that. And therefore it's adaptable. But particularly if you come to it with complex conditions, you want to be sure to work with someone that has some experience. So we have a program at Osher for Parkinson's disease. We've worked with stroke recovery. We've seen everything. We've done some work with cancer survivors. Things, you need to approach things carefully, but by and large, it's very adaptable. And there's examples of that in the scientific literature.
Okay, perfect. And if people were interested in taking your class, we're going to send out the information afterwards, but it's open to everybody, right? There's a fee for it.
Yeah, there are two ways to go through it. One is through the Osher Center, and pretty much every 2 or 3 months, either myself or one of our team offers a half-day workshop. And it's a really nice way to get into the material, and they're given some videos to practice at home with and some literature to go with it. And it's a great sort of entryway. There are lots of good Tai Chi community places in the community right now. Some of them are offering virtual programs. And then my personal school is called the Tree of Life, and you'll have some material for there. And yeah, you can look at that, and that would be one way to engage.
And things like having it on a DVD or a YouTube, I imagine it's not quite as beneficial as having an interactive course.
You know, a lot of people learn that way. Interactive sometimes isn't as interactive. It might just be live. You know, if you have a group of 40 or 50 people, it's not that interactive, but there's opportunities in well-taught classes to ask questions, or if issues come up, you can, you know, email or ask a question to the group. But yeah, I think so. What's nice about live programs is they tend to get less monotonous. But it's also nice, you can go a long way learning some basic things.
Okay.
And we have a program through Harvard Health Publications. So you can go to Harvard Health, and there's a really nice summary of the state of the evidence. And with that, we put together some nice videos for home practice.
Oh, great. So we'll make sure to make that available to all our attendees. Okay.
Yeah, and that's nothing I own. I
Great.
just did it for Harvard Health.
Nice. All right, we're running out of time, but there's a couple more interesting ones I wanted to get to, and I apologize to everyone if we don't get to your question. There's a lot here, but someone was asking, why isn't there more research about Tai Chi and sleep?
There actually is a lot of research on Tai Chi sleep, and one of the areas that it shows promise, I would say, in the second tier below falls and some of the other conditions. I didn't focus on it, but there's actually pretty good in terms of sleep quality. You know, duration of sleep, latency in terms of how long it takes to get to sleep. In terms of apnea and those sorts of things, not so good. And those are important, of course.
But quality of sleep. So just another example of the quality of life improvements that you've seen so often with Tai Chi. That's amazing. Because sleep right now, especially for people, is a big concern.
Yeah. I'm not a great sleeper, so but it helps me. And I'm not a very unnervous person, so I'm really glad I have these tools to manage whatever I have. But I think it helps, and looking at the scientific literature and talking to people directly from my students, sleep is actually up there. Cancer-related sleep is a big issue, and there's some really good data for cancer-related fatigue and sleep. But in general, just sleep quality has been shown in a number of populations to improve.
Okay, great. Someone's asking how often in a week one would want to do Tai Chi to get those benefits.
Yeah, that's a great question. And I think the second part is to get those benefits. And then the third part is which specific benefits. And so, it's one of my teachers would say, it's a little bit like the question, how much do I need to practice piano? And it depends. If you want to play a little song after dinner for your friends, that's really different than if you want to play at Carnegie Hall. So, for most people who are relatively healthy and active, you can get a lot out of doing a good class once or twice a week, and then maybe practicing a little bit of that around your regular routines. Our goal is to teach these principles so that even when you're taking a walk, you're breathing and being mindful. Even as you're sitting at your desk writing a Tai Chi grant, which can make you very stressful, every so often you go, okay, yeah, I know this is supposed to be good for me. So that's the goal. But if you have a serious illness and you want to make a dent in it, you may need to devote more time to really addressing. And many of the famous healers out there, the Tai Chi teachers, were all on their deathbed, and Tai Chi cured them, and then they devoted their life to it. And those are all anecdotes, but it's quite remarkable how many of the teachers that live into their 80s and 90s say, I had tuberculosis and emphysema, and nothing was helping me, and I met this teacher, and here I am.
Wow. And well, on that note, I think we should end, but this was a fabulous presentation, and I think everybody came away with some awesome tips, and we'll send out information for people if they want to get in touch with you or look at your course, or just to look up how to do Tai Chi on their own. So thank you so much, and thanks everybody for participating, and we'll see you next week. Next week, we're going to be talking about gut health and motility with Dr. Supriya Rao, who is a GI physician. So thank you, Dr. Wayne, on behalf of everybody.
Thank you all. Thank you, Dara, for organizing this.
Bye-bye.
My pleasure.